today we've got our mobile stroke treatment unit here. We're really excited about it. This is really a new frontier when it comes to treatment of acute stroke. We're able to take treatment directly to where the patient is rather than waiting for the patient to get to the emergency room. If there's a suspected stroke, we'll be able to evaluate the patients on scene to determine if they're having a stroke or not and treat them right here on the ambulance before we even get to an emergency room.
We feel that this is going to be not only incredible on increasing the number of patients that are treated in the golden hour, which is the first hour after the onset of symptoms, but also a better way to get patients to the right place for care. We think that this is going to be dramatic not only for ischemic stroke, but also for hemorrhagic stroke. If you have a bleeding in your head, we're able to make that diagnosis early on, alert the team in the hospital, and have a surgical team ready to go when you get into the scene.
We'll have multiple people riding along. There'll be a critical care nurse, there'll be a paramedic, as well as a CT tech and driver. And then based on scheduling, we'll either have a vascular neurologist on board who can evaluate the patient, or we'll have telemedicine equipment where the neurologist can then see the patient remotely, similar to what we do with other telestroke system hospitals. We'll be able to do the CT scan of the patient, examine them, and then we have the medications on board. So whether it's a clot-busting medicine that we need for an ischemic stroke, or if there's a hemorrhagic stroke, so that say they have bleeding, we'll have reversal agents so we can reverse that, stop the bleeding many minutes before they would even be able to get to the ER and have it done there.
Mobile stroke unit is just the beginning. We have actually a program of community awareness that will make a difference on getting the word out of how to identify the signs of stroke. Remember, FAST, the acronym of face, arm, speech, and time to call for help. We have to kick the butt of stroke.